They have been the warriors in the deadly war against the coronavirus. And while they remain our heroes, the virus is turning them into victims. Close to 500 healthcare workers have now tested positive for the coronavirus, while the government says that hospitals are well equipped with personal protective equipment. Hundreds of healthcare workers are left exposed. In an interview with NTV, a nurse who contracted COVID-19 opens up about her experience working on the front line. As per her request, her identity has been concealed.
My first pregnancy. So when I had news that I was confirmed COVID positive, at first I was feeling like I'm going into depression already.
Jenny, not her real name, is a nurse at one of the biggest county hospitals where she suspects she contracted the virus while pregnant. A woman who had been at the hospital for a month after giving birth passed away. A COVID-19 test following her death revealed she was positive, prompting the hospital to order all staff to undergo tests.
All the nurses started testing negative. So there are almost so much worries. But I was a bit worried because of my pregnancy. So I felt my immune system is quite low.
Jenny's was among those that came back positive. Close to 500 healthcare workers have tested positive for the virus, raising concerns as to whether enough is being done to protect the frontliners.
So once you have a mask, that's the only protective gear you have. So for the PPEs, mostly those who have it are working in the emergency units and the outpatient, those who meet the patients.
How many hours are you in contact in the area of the risk? You're just sitting there, not even doing anything. And that takes more hours than the other health workers.
Jenny has been asymptomatic throughout her 10 days of self-isolation, but she still nurses fears over the future.
The only bit that I'm scared of is the stigma. Now you see, I have received phone calls from all over, including staff who I don't even know in person.
She, however, offers consoling words to those who may be in a similar situation.
To anyone who is COVID positive, and maybe it's a health worker, I would say, in line of duty, you will never know what you'll encounter. But all I have to say, all in all, let's put God first. Let's try and do our best.
A delay in receiving test results and the lack of personal protective equipment for all nurses are just some of the issues that are hindering the fight against the virus. The Ministry of Health urgently needs to deal with these issues to ensure that the safety of healthcare workers is truly taken care of on the front line. Gena Kirori, NTV.